People with schizophrenia often experience negative symptoms such as apathy, low motivation, and social withdrawal. These difficulties can make everyday activities, washing, dressing, eating, and maintaining basic routines, hard to sustain. Token economies were developed to encourage patients to re-engage in these essential behaviors by using the learning principles of operant conditioning. Token economies became widely used in psychiatric hospitals during the 1960s and 1970s. Although less common today, they were originally introduced to increase activity levels and reduce negative symptoms. The system focuses on positive reinforcement, meaning that behaviors are strengthened when followed by something that increases the likelihood of them happening again. How token economies work. Clinicians identify simple, useful target behaviors that they want to encourage, such as brushing hair, making a bed, helping with chores, or joining activities. Whenever a patient performs one of these behaviors, they receive a token. These tokens can later be exchanged for privileges, such as snacks, leisure activities, or extra time with visitors. Aylin and Azrin demonstrated this approach with long-stay female patients. Tokens, printed with one gift, were given for behaviors like completing chores and were exchanged for rewards such as watching films. This system led to a significant increase in desirable behaviors. Why tokens become reinforcers? Tokens start off with no value. They become motivating because they are repeatedly paired with meaningful rewards. Through classical conditioning, tokens turn into secondary reinforcers, objects that gain value because they predict access to something pleasant. If tokens can be exchanged for several different items or privileges, they function as generalized reinforcers, which are even more powerful. Sran and Borrero found that people responded more consistently when tokens could be traded for a variety of rewards rather than just one. The exchange system. A core feature of a token economy is the opportunity to trade tokens for backup reinforcers. Exchanges usually happen frequently, especially early in treatment, so that the link between behavior and reinforcement remains strong. The longer the delay between receiving a token and exchanging it, the weaker the reinforcement becomes. Kasdan showed that long delays reduce effectiveness because other behaviors may occur in between and accidentally be reinforced. Learning principles behind token economies. Token systems rely on operant conditioning. Key ideas include: positive reinforcement, behavior increases when followed by a desirable outcome. Primary reinforcers, naturally rewarding, e.g., food, comfort, relief from boredom. Secondary reinforcers, neutral items, e.g., tokens, that gain value after being paired with primary reinforcers. Reinforcement must be delivered immediately after the target behavior so that the correct behavior is strengthened.